Let's go to Sydney, Australia and speak to Mary-Louise McLaws, an advisor to the World Health Organization. Mary-Louise, thank you so much indeed for your time. I mean, you'll know full well that it was the FDA itself that pinpointed the fears about rare cases of inflamed hearts, including myocarditis is a medical term for one of those conditions, amongst these children between ages 5 to 11. How rare?
Good evening. It is very rare, but young boys, particularly young teenage boys or those in their 20s and 30s, are 3 times more likely to get myocarditis or pericarditis than young women. Now, because these children are so young, they probably haven't had a viral respiratory infection to have woken their parents up to their risk of myocarditis or pericarditis. So this may be the first time that they may experience this, because one of the contraindications of Pfizer is if you've ever had pericarditis or myocarditis, and often in young men, it's after a respiratory infection. So they'll have to watch very closely, these children, for exhaustion, not being able to walk around, chest pain, etc. So hopefully children, parents will be given very good advice about what to look for a rare, very rare event. Because remember, there's only a few thousand children who are actually given the vaccine. And because this is so rare, these side effects would never have been identified. So as we roll it out into the real world, into about 22 million children in the US, 22% of children in the US, then it's more likely that this rare event will be identified. So they will have to watch very carefully.
Yeah, I mean, in terms of stopping the spread of the virus, clearly, we need to get as many people vaccinated as possible. And why children don't suffer as much physically as older people do, of course, if they get the virus, they could easily pass it on. Is Pfizer-BioNTech leading the international race to have children in this age category vaccinated? Because, of course, it's only one product, and there are so many more that could be useful.
That's right. I have heard Moderna are also developing their vaccine for children as well. And I'll just remind you that in America, around about 6.8 million children have had COVID. That's an enormous number. And 2% of them may have had serious COVID, because it's around 2% of the age group that go to hospital. And so that's far too many young children who have been out of school, very sick, and take a while to get better. And we do know that children are more likely, if they've had serious infection, to have long COVID. So it's a really good thing that Pfizer and hopefully other manufacturers of vaccines, such as Moderna, will be producing something for children. Because while 98% are mild cases, they have been seen in some studies to be able to transmit it to others, including children and adults, just as much as adults can transmit it to others, because Delta is at least 60% more infectious than Alpha, and Alpha was already about 50% more infectious than wild strains.
Mary-Louise, the World Health Organization is urging richer countries to not vaccinate their younger people and instead give those vaccines to poorer countries. What's your opinion if we continue to go the way we are going with the vaccine inequality that currently exists? What does that mean for the pandemic globally?
Oh, look, only about 36% of the world has been vaccinated. In other words, low and middle income countries have not been vaccinated, and less than 2% of the ultra poor countries have actually been vaccinated. So what I'd like to see are manufacturers making even more vaccine, so that when we're seeing such large numbers of children going into hospital because large numbers of children are catching Delta, that we get equal amount of vaccine into low and middle income countries. So I think that perhaps we could do both, manufacture enough so that other countries can be vaccinated for at least their first dose, let alone their second. But equally, we need to look after children because we still don't know what the long-term effect of COVID is for them.
Mary-Louise McLaws, always a pleasure to have you on. Thank you so much indeed.